Well, good morning, everyone, and welcome to the latest Detroit Regional Chamber Tele-Town Hall series. First, as always, we hope you are well and staying healthy. And secondly, obviously, our thoughts are with our fellow Michiganders in Michigan and the Midland area who are obviously dealing with a very serious flooding situation there. And we know that many of our friends at the state level are working, and our first responders are working hard there. So our hearts go out to them. We are obviously in unprecedented time right now. We constantly talk about the toll that COVID-19 has taken on the health of our fellow Michiganders. We have become a hotspot. Fortunately, we are beginning to turn that curve, which is great, and it's a testament to the effectiveness of some of the stay-at-home orders. We also talk a lot about how this is impacting our economy, our businesses, particularly our small businesses, and the economic devastation that we're seeing across the state of Michigan. What we don't talk a lot about is how this crisis is going to impact our state budget and our state financing, which is a very important and serious issue. So today, we are pleased to have the State Budget Director, Chris Kolb, with us. Chris is a former state representative representing the Ann Arbor area and is the former CEO of the Michigan Environmental Council. And he now has what I consider to be probably the toughest job in state government, which is the head of our state budget office. So Chris, welcome, and thank you for taking your valuable time to join us and our chamber audience today.
Well, thank you very much for having me here, Sandy. I did decide to dress up because I haven't had a haircut in about 10 weeks, and I'm trying to distract you with the suit and tie versus what's going on top of my head. But I do appreciate, honestly, being here and being able to give this presentation and answer some questions. We are in unprecedented times, both from a public health and a financial crisis. And then here in Michigan with the flooding and what's going up in Midland. So our thoughts are out to everyone in the state of Michigan, but especially today for the folks up in the Midland area.
Great. Chris, I know you have a colleague who's actually listening in and might be able to contribute, Michelle, and so I welcome her as well. But I understand you have a presentation. I think our audience can see it, and if you want to flip through those slides, give our audience a view of what the state is facing, the enormous financial challenge that our state is facing. I think our audience would appreciate that. Then we can engage in a little Q&A after the presentation.
Thank you. And Bethany Wixel, our Director of Legislative and External Affairs, is with us today. She did a lot of work on this presentation, so I have to give credit where credit is due.
Great. Thank you, Bethany. I'm sorry I got your name wrong a second ago, but the floor is all yours.
All right, let's try it this way. It is not.
So Chris, just make sure you have your cursor clicked on the presentation.
Yep.
Yeah, there you go.
There we go. Hang on.
Yeah, and there is a delay.
I let somebody else drive, but I talk, they drive. So apologize for that. Last Friday on May 15th, we had the Revenue Estimating Conference where the Department of Treasury, the Treasurer, the fiscal agencies from the House and Senate agreed to what the revenues are for the state of Michigan for both the current fiscal year and then looking out to the next and even onto fiscal year 2022. And so you can see what we felt was coming, but was really made clear on Friday. That we are facing in the current budget year a reduction in revenue of $3.2 billion. And we have less than half a year left. And so that even increases the depth of or increases the magnitude of what we have in front of us. And it doesn't get any better really for the next coming year, which will start for the state in October. where we have a $3 billion hole. And then even the year after that, you can see it's about a $2 billion hole. So all in all, it's about an $8.2 billion hit to our revenues. And the state of Michigan, you know, like 48 other states, have to have a balanced budget, and we cannot run a deficit. And we thought it'd be, you know, to give you some context of you know, what the general fund and the school aid fund looks like. This is a combined budget. They are combined just under $25 billion. But the main takeaway we wanted you to see from this screen, not only the pie chart and how that money is spent, but that 75% of the general fund and the school aid fund goes out to external entities. So it goes out to our local governments, our school districts, and our external health providers. And another 10% is spent on public safety through our corrections and state police. So 85% of that is really tied up into third party or public safety expenses. The general fund, which is the one that we have the most sort of discretionary over, and which as a legislator you always want to delve into, is this year we started off at about $10.6 billion. 80% of the general fund is spent on healthcare, protecting vulnerable children and adults, public safety, and education. And I'll take everyone down to that gray slice of the pie that says all other, 17%. Well, those are the rest of state government. I could, if I eliminated that gray, that would be taking dollars out of 12 departments plus the legislature and the judiciary branch, and it would not equal $2 billion. So that just, you know, trying to put in perspective, you know, what's out there to potentially reduce if we have to make up that $3 billion this year. This slide is the federal dollars, and it's really there not so you have to follow it or you know, take a whole lot from it, except that, you know, even though there's only two funding sources, where the federal government or the state, you can see how things flow through the federal government onto the state government. In each one of those federal departments has guidance and reporting requirements that we have to follow. So as we receive the money on the state end, we have to make sure that we're using it in the correct way, that we can stand up to any audit in the future years, and making sure that our reporting is correct. So there's going to be a lot of work after we receive those funds, and that guidance is constantly changing, being updated. We'll ask a question and it might get answered, but the answer usually raises another 3 or 4 questions that need to be responded to. So Michigan received, you know, a lot of funds to the federal government, as you saw from that previous sheet. But the big one that most people have been focusing in is in the CARES Act, where there was a direct assistance to state and local governments. And Michigan's share of that money was $3.9 billion. $800 million of that went to local governments who had a population over 500,000 people. And that includes the city of Detroit, Oakland, Macomb, Wayne, and Kent County. So they have their money, it was sent to them directly. That left about $3 billion for the state to spend on COVID-19 response costs. And the money isn't, we can't just use it for anything. By the current guidance from the U.S. Department of Treasury, we can only use that for COVID-19 response costs. They cannot be costs that are currently in our state budget, and they have to be used and expended by the end of this year. And the big takeaway for that is that we cannot use this to backfill any of our revenue loss right now. And so Michigan, as well as the other 49 states, are been requesting the federal government to give us more flexibility in how we use those dollars, and specifically to use those dollars to backfill our revenue loss. And that is the big, ask that's out there currently to the federal government, is to give us flexibility on these dollars. And then as we get moving, we're going to be requesting additional dollars as well. As you know, that the U.S. House did pass the HEROES Act, and we're waiting for movement from the Senate and the White House, which I think we can get to the Q&A. But just looking at the dollars that we have, there was another line item within CARES Act that gave money to elementary and secondary school needs. Michigan's share was just under $390 million. This goes to local education agencies, including charter schools that are local educational agencies. 90% of the funding is based on their Title I allocation. So there is a funding formula. The money does flow to the states, but then goes to the school districts. It has pretty broad discretion in how they can use that. You can see down below in the lower half of that slide that it can go to, really meet the needs of the schools, addressing needs of the students, including at risk, children with disabilities and other groups. They can use it to purchase technology and other virus response activities, including training, sanitation, meals, mental health. And then there's another pot of money that was for higher education. Michigan's share was $347 million. That goes directly to public and private universities, institutes of higher learning. It's distributed based on sort of a formula that's based on 75% of it is on the number of Pell Grant FTEs they have, and then 25% on the non-Pell Grant recipients. This money, though, does not have the broad discretion that the elementary and secondary education institutes have. For this, the university direct portion is they can be used to cover any costs associated with significant changes in the delivery of instruction due to COVID-19, but 50% of these funds have to go to provide emergency financial aid grants to students. So the universities and institutes themselves only get 50% of that money. And there's a third pot for education, and that is for the Governor's Emergency Education Relief Fund. It's just under $90 million for Michigan. It can go to the local education agencies, institutes of higher education, and other education-related entities. You can see sort of the allowable uses there. But we're thinking of this generally is that we want to use this to kind of fill in the gaps that are missing from the other education funds. So once elementary and secondary schools know what they're doing with their money, what the universities are doing, we can use this to fill in the gaps that aren't covered by those funds. And we have quite a bit of discretion here. There also was a child care relief fund. We announced a couple weeks ago about how we were going to use this, but Michigan received just over $100 million. We also are marrying that with $30 million that we have in carry forward dollars to help our child care industry here in Michigan survive and provide services during this time. The recipients under our plan can be licensed child care centers, licensed child care family or group homes, licensed exempt providers as well. And we're making monthly payments to these providers during April, May, and June. The grant amount is made up on a flat rate basis by the provider type. There's a bonus payment if they're open and caring for children of essential workers. There's a component that's based on their STAR rating quality. And then there's a per student, there's a per staff stipend as well. The funds are pretty flexible, as you see down below, and they can support a range of expenses, including but not limited to payroll, mortgage and rent, utilities, and insurance providers as well. And we have, here's just a list of some of the other COVID-19 federal funds that are out there. There is money for testing and follow-up. Michigan share is $350 million there. There's transit dollars we got both for urban grants, which are direct payments, non-urban grants. The airports were supported, child nutrition programs, the community service and development block grants, elderly services, emergency service for homeless, public health, and rental assistance as well. And then, in that CARES package as well, there was, money for individuals, small business support, and our healthcare providers that got direct support that was not didn't flow to the states, but did flow directly out. And so far, we have received about $1.1 billion that our Michigan health providers have half, and only half of those dollars have been dispersed. The first half was aimed at Medicare receiving institutes. So the Medicaid folks will hopefully be seeing their funds soon as well. So the state obviously has tightened its belts. We instituted a hiring freeze several weeks ago. We froze all discretionary spending. We did a 2 to 3 week full-time temporary layoffs for nearly 3,000 state employees. And we have just implemented 10 days of temporary layoffs for 31,000 state employees working through the federal work share program. And then we continue to evaluate other potential budget reductions on a day-to-day basis. And that really gets to the end of where we're at, and open it up to questions as well.
Great. Chris, thank you. That was a terrific overview, and it really does kind of highlight the challenge the state has in front of you. So several questions based on your presentation. Number one, you mentioned the HEROES Act, which was passed by the U.S. House, but the Republican-controlled Senate and the White House have basically called it DOA. What are the kinds of things that you, as a state budget director, need from the federal government to basically continue business as something resembling normal as we emerge from this COVID crisis?
Yeah, I mean, number one, we need flexibility in the dollars that they provided to the states and local governments so that we can use that for revenue backfill. This is not a one state problem. This is all 50 states are dealing with this. This is our number one, our request to Congress and to the White House is that they give us flexibility in the dollars they provided, and that two, they provide additional resources so we can make it through. Every state is dealing with unprecedented, loss of revenue here. And the only way we're going to make it through this together is if the federal government is able to free up more resources and allow us to use that to backfill our services. In the couple of the slides we presented, the big takeaway there is that 80% of our money goes out to third parties. It goes out to our schools, it goes out to our healthcare providers, and the local governments. And we cannot cut enough out of state government internally to fill that type of a hole. So if we're going to help not only for Michigan to be able to provide needed critical services at this time, but for our local partners as well, we need the federal government to come to our rescue. And this, is as bad, if not worse, than the Great Recession. And the only way that states were able to make it through was because the federal government provided the funds that allowed us to backfill our revenue loss and continue to provide critical services to our residents.
Chris, I think one thing that I want to make sure that our audience really understands is the scope of the revenue deficit that the state is expecting. So when people hear that the state of Michigan's overall budget is $55, $57 billion, you know, a $3 billion cut or deficit could seem like a small number, but explain why that $3 billion, based on the discretionary dollars that the state has to spend, is a really huge deal.
Well, if you go back to the, I won't pull it up, but really looking at, you know, where we're being hit is loss of income tax and sales tax. And where those monies go, you know, are really to our general fund and to our school aid fund. That's what we focus in on. That's that $24.7 billion. We're halfway through the year. So, you know, you can do the math. That's, you know, around $12 billion. We're now saying with less than a half a year left, we're going to take $3 billion out of that. That's huge. And, you know, for schools and for local governments, they have even less time left in their fiscal year. So most of them end on June 30th. They need to know what those cuts are now. And so that's what we're working with the federal government, is that we think it's bad that we have only until end of September to make adjustments. They would have to make adjustments, you know, within just the next couple months. And so that's really the big problem here, that it flows not just to the state, but down to our local governments, our schools, and to our healthcare providers as well. So this is, you know, critical that the federal government steps up to the plate and helps us out. And as I said, this is not a blue state or a red state issue. This is not a Midwest, West Coast. This is across the country. All 50 states, all 50 governors are asking the federal government for more resources and flexibility to address the revenue loss that we all are seeing due solely to the COVID-19 virus.
So, Chris, talk about you know, the funds that come from the state to state and county and local governments, kind of this revenue sharing model. You know, what are the kinds of products, services that the counties and the cities are providing their citizens that could be at risk if we're not able to backfill some of these dollars that we were expecting from either income taxes or property taxes that generally flow to the state?
Yeah, I mean, they're for, you know, a lot of small, or for local governments, you know, number one, there's about 26 that have a local income tax that helps generate funds. City of Detroit being one of the largest entities to do that. Obviously, income tax incomes are down, so thus income tax is going to be down. They are going to see a loss of revenue. We know that constitutional revenue sharing, because it's based on sales tax, and sales tax being down, they're going to take a hit there. So not only are they seeing the revenues going down, but obviously they are having increased calls for service as well. Public safety is, you know, one of the big ones for local governments. That it's really at the local level that our residents interact with government, and public safety is a huge one for them. Obviously at the county level and on a regional basis, public health is another area that we're seeing increased cost there too. So it's across the board. There are partners, and we hope to be able to help them. But any dollars that we have that flow down to them from the federal government that are coming through the CARES Act have the same restrictions as we do. So they cannot use it for a loss of revenue. It can only be used for COVID-19 emergency response activities, and it can't be for something that's already in their budget. So that's, you know, a really important point to make, because as we can't use it to backfill our revenue, neither can our local partners as well. So we know that, you know, life has changed dramatically. The way that we have to deliver services is changing and will be changed until there's, you know, a vaccine or a cure. That they are incurring costs, as well as how they have to interact with the public, just as the state is as well.
Yeah, I think that's an important point for all of us to understand, that, you know, while as a former federal official myself, I can say with confidence that the federal government has been probably far more proactive and far more generous in this crisis than going into the Great Recession. But all of the dollars that the federal government has provided to date is for direct COVID response issues and is not in any way backfilling dollars being lost to property taxes or any other kind of general operating fund, any general operating funds that states or counties or cities would normally have. But speaking of that, one of the good pieces, or one of the other good pieces of the federal response is that the way they're handling unemployment. Obviously, they've extended unemployment benefits in terms of dollars, in some cases making it so generous that we're having a hard time bringing back employees. But that's an issue we can talk about in a bit. But the issue I want to talk about here regarding unemployment is that the state is not on the hook for these additional unemployment benefits, and frankly, nor are the Michigan employers in terms of taxes that normally would be applied to them for their employees going on unemployment. Can you talk about both those issues, please?
Well, I think there are two things that I'll bring up. One, yes, the $600 per week it's being provided by the federal government, which is a big relief for lots of folks out there. We have over 1 million people have applied for unemployment here in the state of Michigan. We have record unemployment across the country, the depths we haven't seen in a generation. So that is a big relief. Unfortunately, that $600, though it's taxable from the state level, the local income tax it's not. So that's a part for them. But the other part I wanted to really talk about is that the shared work opportunity that's out there through the federal government that Michigan is utilizing for 31,000 employees who we put on temporary layoff, reducing their workload by 20%. That you're able to do this at the private level as well, and so it's a good thing. The other thing is that the federal government also gave 13 more weeks of uninsurance coverage. So really have stepped up to the plate and will help out. But I do believe that people do want to get back to work when it's safe. And the other area that from an employment area is not only, you talked about the pay, but I think that workers need to feel safe when they go back. And so we're going to have to work with businesses to make sure that they have the ability to make the workplace safe. The governor released executive order talking about workplace safety this week, and we'll continue to have to work on that, because really what the economist said is what's driving this recession is the virus, and then individual personal behavior, that folks don't feel safe going out there. And even though you've seen some photos in states that have opened, if you look at Open Table in some of the states who have opened up the restaurants, there's not seeing the return of customers. And that's because on an individual basis, we're making decisions that we feel we're safe in making, and no one feels safe right now doing the things we used to do. So businesses and governments are going to have to invest in making safe workspaces, and we're going to be have to help especially small businesses with that as well.
Chris, one of the line items in the budget that organizations like the Detroit Regional Chamber, the Detroit Regional Partnership, Ann Arbor Spark all care deeply about is the Michigan Economic Development Corporation, funding and support for economic development activities, which perhaps is going to be even more important as we move into this environment where we've had so much economic loss. What is your thought at this early stage about what this might mean for some of the MEDC programming?
Because this hole is so big, I think that, everything has to be looked at. Everything's got to be on the table. They have, on top of everything that's going on out there, because the casinos are closed down, there's going to be reduced revenue to the Michigan Strategic Fund. So we're going to have to be looking at everything, but we have been trying to utilize the resources we have to help out. MEDC utilized, $10 million for grants and loans to local governments. We're going to have to be working with local I meant to say small businesses, and we're going to have to be working with small businesses, to get them trained up and ready to open up when the time comes. I think everything, we're entering a new normal. I don't know what it's going to look like. I don't think that any of us do. And there's a lot of uncertainty there. What I can say is that if we can get the federal government, get the Senate and the White House to engage on the HEROES Act, and we can call on them to give states the necessary resources and the flexibility, we can get through this, and we'll have then the funds to do, public health, education, public safety, and yes, economic development.
Chris, one of the things that your administration was able to inherit was a rainy day fund of over $1 billion, which was built up over the last 10 years. We didn't have one back 10 years ago. My line was that we had a rainy day fund 10 years ago that would have got us through an episode of 2.5 Men. Now you've got about a little over $1 billion. How does that help ease a little bit of the situation the state finds itself in now?
I mean, it's definitely a resource that we have that we depleted before. We actually depleted it when I was in the legislature, and we were dealing with Michigan's unique recession back in the early 2000s. And that, it sounds like a lot of money, but it's 5% of that combined general fund and school aid fund budget. And we have, a $3 billion plus hole for this year. So 1.2 does not fill that hole completely. And you wouldn't have it for next year as well. So it will be a tool, but it's not something that's going to fill up the hole completely. And I think we'll have to be very strategic as to how much we use in any fiscal year, and how much we have to use in the coming years as well. So it's very much, on our minds. I think people go to it immediately, but while 1.2 billion sounds like a lot, it won't fill the hole, and it will disappear in the blink of an eye.
Well, as Everett Dirksen said, $1 billion here, $1 billion there. Pretty soon you're talking real money.
Yeah, you do.
Chris,
there's a few big levers that we have to pull. No. Putting them all together still doesn't hit the, $6 to $8 billion that we need to do over the next 2 years.
No, absolutely. I was just making it. No,
better than not. I got it. Yeah.
Better than not having a rainy day fund.
Listen, I am grateful.
It only covers a short period of rain, not a long period of rain, which is what we're experiencing now. I think we definitely agree on that. The other priority that so many have had in Michigan, and certainly your boss, Governor Whitmer, was state infrastructure. And I can't imagine what kind of damage this budget crisis is going to do to any attempts to make progress on fixing Michigan's ailing infrastructure.
I mean, I think number one, unless we get, some help from the federal government, to fill this hole that we and the other states are meeting, we do have to look at all, expenditures are out there. Nothing can be taken off the table. Obviously with roads in particular, with gas, revenues, falling because we're just not driving as much as we did, that we have to take a look at this. But clearly roads and bridges are a public safety concern to us. They are a top priority for the governor. So we are looking at, at that and figuring out ways that we can continue to move forward. I think it's one of those areas that we can continue to invest in and drive economic development here in the state of Michigan. But we're going to have to look at every dollar and every source of those dollars to see if, how they play into the overall budget decision-making progress, decision-making that we have to make in the next couple days and weeks to get through this. But it is a priority as our education and public health. So those are the areas that we're really looking to help to avoid making, significant cuts to.
Great. Chris, let me welcome Brad Williams, the Vice President of the Chamber, into this discussion. Brad has been monitoring our chat room and I believe has a couple questions from our audience. Brad?
Yeah, Chris, thanks for spending some time with us today. There's a couple questions about just timing. You know, obviously with the revenue estimating conference last week, what is your timing as far as looking at, you know, a potential executive order for this week or for this year, or a negative supplemental? What can people expect?
Well, you know, right now we're working with the governor and her team to, you know, look at all of the solutions that are out there. Number one, we really are, you know, calling on Congress and the White House to step up to the plate and to deliver the flexibility and the resources so that Michigan and the rest of the states can really solve this. This is not something that we can solve on our own without putting, you know, public safety, health, and education at risk. These are critical services that need to be provided by the state and our local governments, and the only ones that can bring enough resources to the table is the federal government. And so we're calling on them. We're asking all of our partners to lobby of them as well to step up to the plate and get this done. And so we're hoping within the next couple weeks to see that movement. Obviously, there's always, you know, positioning going on in DC, but there appears to be movement towards another stimulus package. The House has done its job, put its proposal on the table, and now it's up to the Senate and the White House to complete those negotiations and come to not just Michigan's, you know, rescue, but to the other 49 states as well. But we are looking at, you know, all of the budget lines. We're looking at all the different funds, and we'll be making, you know, proposals, you know, when we know the fuller picture of this. The other complicating matter in this is that we believe that, you know, and it was announced at the revenue estimating conference that we're going to need a third revenue estimating conference in August or September because one, we have delayed the income tax collection until July 15th, like the federal government. And two, the corporate income tax is a new tax. We don't know, you know, how and where it's going to fall out in this, and thus they feel, you know, more comfortable having a third revenue conference. So that will provide us even more information for the coming fiscal year. So this will be a sort of a two-step process. We've got to do fiscal year 20 first, and then we'll address fiscal year 21.
Another question, the governor announced a proposal for the Futures for Frontliners program as an offshoot of the Reconnect program that the legislature passed last year. What is the future of that, and do we have a price tag on that, how it fits in?
You know, I would say that this is, you know, a priority for the governor. We do have, you know, frontline workers who are on the front lines every day, and this is a way to help respect what they're doing for us every day and to give them a brighter future going forward. So we are definitely, you know, moving forward on this. We're still working out the total details of the program. But we hope to launch this as soon as we can.
Yeah, now you and Sandy talked about road funding and infrastructure in particular, but you know the governor, you know, did her bonding plan as part of the State of the State address this winter. Is that continuing on as announced by the governor?
The you know, the department will make, you know, some potential changes to it based on what they know, but yes, they plan to continue to move forward on that bonding proposal.
Last question I have for you, Chris. There's been some suggestion in the media that that bonding could be used to help mitigate some of the short-term deficits that we have in the state. Is that something that that you as the budget director are taking seriously, and what would that look like?
Well, Unfortunately, Michigan has, limited opportunities for bonding for operational spending. So what we can do is use it for cash flow, but it has to be repaid by the end of the fiscal year. So really, since this is a multi-year issue, it really doesn't help us out, unfortunately.
Well, Chris, thank you. Thank you for your time. And I know there was a number of people in the chat that asked about your slides and whether they'd be available.
Yes.
And we are going to post them online at the Chamber website, detroitchamber.com/COVID-19. So those will be available for everyone who's been listening in. So thank you, Sandy. Back to you.
Great. Thank you, Brad. And thank you, audience, for some really great questions. Chris, we're coming to the end of our time. I'm just going to ask you if you have any other final comments you want to leave with our audience before we sign off.
I want to appreciate, you giving us the time to do the presentation, to interact with your members. But I keep saying this, and it was my mantra on last Friday, and it will be going forward, that the only way we're going to get through this is if the federal government steps up to the plate and helps out not just Michigan, but all of the states here to provide us with the resources and the flexibility to use those resources. And so anything that the chamber can do, that your members can do, to really call upon the Senate and the White House to get the HEROES Act done, to come up, negotiate, and provide the needed resources the states need and our local governments need, so that we can continue to provide critical services at a time that our residents really need it. And so that's the hard part about this. If we don't get the resources, we aren't able to respond to the needs of our residents at the time they need it the most. And so the only way we made it through the Great Recession is the federal government providing the resources and the flexibility to use those funds. We need the same thing to happen now.
Okay. Well, the president is, we're going to be welcoming the president to Michigan tomorrow, so hopefully he'll hear that message. But Chris, I'm going to end exactly the way I started, which is just a sincere thank you for your really difficult public service. I was very serious when I said I think you have the toughest job in state government right now. I know we're all watching the governor day in and day out, but the work that you and your team have to do to balance this very, very difficult, unprecedentedly difficult budget situation and still provide the resources that our fellow citizens require is going to be a really difficult act. So please let us know how we can help you and your office during this time. And we thank you and your team for your time today and for your ongoing public service.
Thank you. Appreciate it.
Great. Thank you, everyone. Hope everyone stays safe, continues to have a good day. And as Brad mentioned, this presentation, as well as this video chat, will be available at detroitchamber.com/COVID-19, as well as all of our other Restart resources in the Michigan Restart Center. Thank you all. Have a good day.